Hi, this topic we're gonna talk about temperature, as mean like do we give them warm pack or heat pack, cold pack, and then we're gonna talk about diet that applies to different disease. Okay, now you can download the templates at the description there, and this presentation is for the purpose of private study and research. I used Kaplan U Well Registered Nurse RN, NCSBN, and others resource for these presentations. Firstly, in the exam, the NCLEX RN exam, sometimes they give you conditions and then say, use the heat pack. So is it using the heat pack or using a cool or cold pack? How I do it is I just write a graph about it. I just made a table. Here is the warm and here's cold. For example, for tonsillitis, we use warm soap water for goggles and not the cold or cool one. For example, peritoneal dialysis, we're using the heating pad, not the cold pad. So the way to remember this table is, what I do is I just remember this part, the warm, moist, heated part, not the cold one. Once I remember all these conditions, then if the one that I remember it's not in the NCLEX RN, and then most likely they're gonna be cold or cool, using the cold or cool. So that's how I do it. And then there's exception to the rules. For example, no warm or cold for brachytherapy or therapy in order to protect the skin. And then you can use both warm and hot and cold. For example, rheumatoid arthritis, you use heat for stiffness, cold for pain or inflammation. Now come to the diet. You can say diet, then there's for a healthy diet, you want to encourage the following things and avoid, limit, or reduce the following things. That way I can see the difference. Instead, for example, instead of 2% milk, instead of whole milk, we encourage 2% milk. So the NCLEX RN question say, patient's diet is really healthy within BMI range. So what would you encourage and what would you reduce or eliminate? So here's just a sample of table that you can do. Now fluid, you want to encourage and restrict. With fluid, for the restrict, here are the usually to do with the heart failure or renal failure. So I just remember the restrict fluid section, and then the rest is encourage, I guess, most likely. Next one. Now diet, type of meal. We got clear fluid, thick fluid, soft fluid, normal regular diet. Then type of fluids that's present in a clear liquid, for example, and then it's suitable for what kind of patients. Because they could say, patients on Kawasaki, and then here are the 4 diet. Which one would you give it? So clear liquid. Diet and religious are quite important too. For example, halal, there's no pork, alcohol, or vanilla extract. So it's good to know what culture they are and what they eat and don't eat. Diet, here it's GI with all the condition here, and then you encourage, avoid, or reduce. Here, because I write avoid or reduce, because sometimes you want to totally avoid, but sometimes you can't avoid, you need to reduce it. So I guess I encourage, like you can say, avoid or reduce something something. So the conditions, I will give you example: active diverticulitis, that's MPO. And then when it's recovery, here's the encourage to eat, and here's the thing to avoid. And then once healed, you encourage high fiber. Okay. Now here's different conditions with the diet. And they are all in your templates, which you can copy and paste and get some idea. And you can also use your own study notes and add more to it. And here's this one: conditions, encourage diet and avoid diet. Again, conditions, encourage diet and avoid or reduce. And that's it. So quite simple, just simplify it. And then you can also provide explanation at the next to it of why they encourage this food and why we avoid this food, if it helps you to understand and memorize a bit better for the exam. And that's all. Okay.